Hey everybody, it's Heather from One-to-One Physical Therapy. I wanted to take some time today and talk about chewing. We work a lot with TMJ dysfunction, people with chronic headaches, neck pain, and often these individuals have trouble chewing properly. So normally when we think about chewing, we think about the jaw just moving up and down. And many of you have probably never noticed how you chew, but take note, do you tend to chew on both sides or one side? And furthermore, when you chew, does your jaw come down and go across? So normal chewing should include a sideways element to it. So you want to be able to come down on one side and then cut across, and that's sort of that grinding component of chewing. And typically we want to chew just on one side at a time, but we want to alternate the sides. So maybe each bite that you take, spend on one side, and the next bite, go on the other side. The human body is naturally asymmetrical, and the normal human pattern is that we tend to chew more on the right side compared to the left. There can be exceptions for that. Just take notice if you have a side preference, and if you do, try to bias it so you spend a little bit more time chewing on the other side. So the question then is, why is this important? Couple reasons. One, it's going to help you chew your food better, which is going to help your digestive process. So when we include that sideways component, we not only get the mashing but the grinding, so it breaks down the food better, helps you produce more saliva to help break down the food. The other thing is from a whole body movement aspect. And the jaw, when the jaw is moving side to side, the primary muscles that are doing that are called your pterygoids. And your pterygoids attach to this very important bone in your cranium called your sphenoid. So they go from the jaw to the sphenoid. So when you have one side working, what's happening is that your sphenoid starts rocking side to side because of the muscle action. So if the pterygoid on one side, which attaches to the sphenoid, it's rocking it in one direction, and then if you're chewing in the other side, it would be tilting the sphenoid in the other direction. The sphenoid needs to move. So you have a whole system of cranial fluids up in your brain, your cranial sacral system, and your cranium needs to breathe, it needs to pump. So chewing is an excellent way and a natural human way for this to happen. But due to a variety of reasons, us modern humans are not chewing the way our ancestors were. We can talk about that probably in another time. So one more thing I just want to note is that this part of your body, how it moves, is connected to how your rib cage moves, how your pelvis moves. So when we get locked up in one of these sections, it interferes with the other sections. So there's a connection, a neurological connection between our ability to move our jaws side to side appropriately, as well as rotate, as well within our rib cage and our pelvis. So when you're getting better movement up in this area, you're also going to get better movement in the other areas, and vice versa. When you work on better pelvic and breathing control and movement, it also impacts up here as well. The only other thing I forgot to talk about was the tongue. So when our jaw is moving to the side, your tongue actually needs to work in the opposite direction. And this is because it needs to stabilize your bolus of food. So when your jaw is going off to one direction, the food doesn't go with it, your tongue stabilizes it there. So an exercise that you can do to help this is to practice bringing your jaw forward a little bit to one side, and then move your tongue on the roof of your mouth, kind of along the inner part of the teeth, to the opposite side. And you can practice doing that in both directions, and that will help to develop those neurological circuits that you need to chew properly. So I hope this was helpful, and thanks for listening. Bye.